most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
What,
Bob.
You doing a little jig there, Brad, or what?
Well, Bob, it all relates. Everything comes together in
You'll
life.
see. Okay, we're going to talk about, do you waddle side to side when walking? That's called a Trendelenburg gait, and we're going to show you how to fix.
That's right.
This is an updated video, by the way.
Yeah, 2014 or 15, I think we did it last, so it was ready. It was due.
I was a young man then. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. Always giving something away. No, we're not giving away a level. We're giving away a stretch out strap. These are awesome. I'll tell you, this is a really high quality. You could drag a deer with it, right, Brad?
I have, actually. But yeah, they work great.
Don't tell the animal rights people there.
I love them for hamstring stretches, Bob.
Yeah, it's really great.
And there's a lot of other things,
You can
too.
go to Facebook. It'll also be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That's right.
Not your program.
Well, they can think of it as theirs. But also we do have podcasts out now, so you can listen to us talk about wonderful experiences and knowledge. And better yet, we have some outstanding guests, authors, and experts in the field.
And you don't have to look at this.
Yeah, that's a big plus.
Yeah.
All right, so we're talking about waddling, Bob, or Trendelenburg gait, and I'll just demonstrate it right now.
Dr. Friedrich Trendelenburg.
What he said was Dr. Frederick Trendelenburg.
I was trying to do it German.
Yeah, anyways, he was a doctor. They named it after. And
Sure.
It's quite a while ago, 1844 he was born. He died in 1924.
Yeah.
So people were walking like this for centuries, it sounds like. So it's when you have this kind of a thing. Usually one side is you walk over, and it's typically because of a weak muscle. And we're going to talk about that and actually show you with
that
Sam.
weak muscle may be due to pain too.
Right.
It might have caused the weak muscle because you don't want to take weight on that side, so the muscle becomes weak.
Right. And also, I've had people with this after a total hip
surgery.
Yep.
Absolutely.
So, and other people, it may be for other reasons, but one way or another, that's how it presents, that waddle side to side, right to left. The muscle that helps or maintains your stability is the
gluteus medius.
Thank you, gluteus medius. And this purple tape just shows it connects. It's a broad muscle, kind of like a fan here.
Right.
And it connects down to the hip.
The greater trochanter.
Yep, right there. And all the way up to the top, iliac crest. That's what I'm looking for. The aging process of my memory. You know what I'm saying? So that's the muscle. If we strengthen that muscle, it's going to help stabilize that hip and allow you not to compensate and waddle.
You see if it's strong, it's going to help hold the pelvis up. And if it's not strong, the pelvis could actually dip down like this.
Right, which causes that whole trunk to go to one side.
Causes the waddle.
The waddle.
Yeah.
All right, so let's see. Oh, the test. There's a test that we use, and what we're going to do is it's pretty simple. You can do this yourself. Get a stopwatch, or 30 seconds, or look at if you have an analog. Do they make analog clocks anymore?
I don't know.
You look at your waist level. We have a level. You don't need this.
Yeah.
But what's going to happen is I'm going to stand on one leg and maintain a level pelvis or belt line. So you can look at the belt line, and then if all of a sudden I'm starting to drop like this, and then you go to the other leg, and it's for 30 seconds.
It stays.
Yep, you maintain without that pelvis dropping down. Then you'll know which side is a side. It confirms that you have a weak.
Well, it'd actually be weak on the right side if it dips to the left.
Right. Yeah, it's opposite.
Right.
Yeah, but there's another test I'll show. Should we do that one?
If it dips on the right, it's weak on the left.
Yep, it's opposite.
Yep.
But just drop. Oh, that's
your
mouse.
Microphone, wasn't it?
No, it's a mouse.
Oh.
Not a real live mouse.
Okay, good.
All right. So, Bob, why don't you lay down once? On your left side. Please. I don't want to get bossy. I'd get that way with my patient. I'd say,
Sure.
lay down on the left
Yeah,
side, right now. No, I
Lie
wouldn't.
down in your right
Lie
side.
down. Well, I didn't worry about it then. Can you lift that leg up and straighten it out?
Oh.
There we go. So this is a manual test that I would do. I'd push down here, hold it, hold it, hold it. And if you're strong and normal hip abductor, you can hold a lot of weight and it's fine. And I'd do one side, have the person roll over.
And check the other side.
Yeah, we don't have to show them for that, but we're going to assume you found that one side drops, you have the waddling gait. Maybe you did a manual test if you had someone to do that if you'd
Sure.
like. But the exercises, we're going to start out actually in the same position you just were for the test, Bob.
Sure. Yep.
Go ahead.
And I can do it with a band or without a band.
Yep.
I'll start without a band.
So we've decided that this is the weak side. And what you can do is you can do these exercises on both sides, but you'll
Yeah.
notice the weak side.
So I'm going to work hip abduction, and you're first going to start, especially when you got a long leg like mine, Brad.
Yes.
You can start without any weight because the weight of the leg is going to be plenty for you for the first couple of weeks, probably.
Right. I would say 10 repetitions.
Keeping the toe straight forward. Don't go up like this.
Yes. I mean, no, this
No.
is right. And you're going to find out, boy, you'll feel that hip abductor muscle. And 10 repetitions, if you can do 10 good quality ones and it feels pretty easy, then you may want to go to 2 options. You can use a loop band like this.
This is the Bob and Brad band,
Yeah.
booty band, I think we call it.
There's these other ones that made it. That's out of cloth, elastic, and they have these rubber ones. These are a lot more comfortable. That's why we
this is a little harder
like them.
work.
That's quite a bit harder. And if you move this up towards the hips, it's
A
easier.
little easier, right?
Yeah. And so you can adjust that. You'll get a feel for that relatively quickly.
It's hard either way. No, it's a little better that way.
Yeah. So again, and you can just see him
Keeping it
struggling.
straight,
Yeah.
yeah.
So if you did this for another week or 2, you're going to find that gets easier.
And yeah, if you're just starting out, you don't do it every day,
Right.
and you don't go crazy the first time because your hips can get really sore and you can actually get micro tears in the muscles.
Yeah. So don't go too
Especially
crazy.
you're older, like we are.
Now, we're showing you some other options. You do not have to do them this way. There's some strengthening exercises you can do standing, which actually I kind of prefer as long as you can do them safely. And
It's a little more functional.
right,
Do
exactly.
you want me to show the side plank?
Actually, let's do that. That's another option lying down.
That's a tough one, actually, Brad.
And you do not need the loop
No,
band.
you can start with just on your knees like this, and you're going to go like this. Now you're working the bottom one,
Yep,
and you're working the top one
right.
for
So,
hip abduction.
yep, and that is a beauty of that
Yeah.
one.
Now you can do it with the legs straight too, and this gets a
Yeah,
lot harder.
That's pretty aggressive. It depends
Yeah.
on how athletic or how strong you are, but probably starting out his first
and
time
you would
on
do
his
it on
knees.
a wiggly mat. I mean,
Right, you
on a
probably-
cushion, you do it on the floor.
And probably not in a bed.
Yeah, exactly.
Unless you got a real firm bed. But again, 10 repetitions is a good goal with all of these. And you may want to do that one on both sides. What are you looking for,
A
Bob?
mouse.
Oh, yeah. Don't worry about it. I
Oh.
found it. So shall we go on to the next one?
Sure.
Okay.
All right, dude. Now, as Brad alluded to, that he's going to do some in the standing position, which is a lot more functional.
It
Yeah.
is. It is. It's actually it's easier
Closer
to
to
do.
real life.
And you don't have to do all these. You pick the ones out that work for you, that you feel comfortable with. If you do need to have a resistance band.
Of some sort.
Yep, and it works out. Sometimes you don't need the handles on there, but it can be helpful. You'll see why when I demonstrate it. You stand on it, and you need to have shoes on with this. You don't want to do it barefoot. You could, but I've always had my patients with shoes. And then you pull up on here a little bit and give some resistance, and you simply walk sideways, and you don't have to go fast. You're probably better off doing it slow and controlled. This doesn't look like it's very hard, but if you just do it, I can already feel my hip abductors working and doing overtime work right now. And you want to go both directions. I usually have my patients go about 10 feet. And you know, you don't have to measure out exactly. But you'll get tired. I'm already I'm starting to get tired.
And safety first. We want to make sure that you're not going to fall over while you're doing this.
Right.
Yeah,
If you
you're-
feel wobbly with this, it's not
Yeah,
an option.
no.
Unless you have someone there to hold you. But even
Or
then,
I was going to say, if you had a loop band like that, you could hold onto a counter.
that's a good point.
Right.
Should I demonstrate that one?
Sure.
I'm going to get the purple one out so it's easier to see.
But again, these are great functional ones, meaning that it translates to real life.
Yep.
Because you're actually walking already. You're actually strengthening the muscles while walking.
So with this, like Bob said, you can hold on to a cupboard. And the further down you go, again, it's more resistance. And if I go up closer above my knees, it's easier to do. So you start higher and go down below the knees as tolerated and go back and forth 2 to 3 times.
Pink looks good on you, Brad.
Oh, thank you, Bob. Wow. There is one more thing. I think this is probably everyone should do. Pick out the exercises we just did. Work on 1 or 2 of them. Don't do them 7 days a week. Do them probably 5 days a week with some days off.
Or maybe even 3 times.
Right, to get started. Right,
yeah.
yep, so you don't get too sore. But if you have a full-length mirror in your house in a hallway or distance to walk, look at that mirror and observe yourself initially when you
Walking.
start doing it and see that Trendelenburg gait. And some people, just by thinking about it, they can improve without the strengthening even.
Just the feedback by watching
Yep.
the mirror.
And then when you walk, think about it as well. Spend 20 or a few minutes walking, really focusing on it. Because a lot of times when you walk, your mind goes other ways you're talking. But actually do some walking where you're focusing on upright.
You might also just take the camera on your phone or videotape yourself starting.
Yep.
And then tape yourself later to see how.
Like
if there's
3
an
weeks
improvement.
later
Yeah.
into this. And then you can say, oh, wow, I'm getting better.
Yeah. Bob and Brad, help me. Imagine that.
The good old Trendelenburg is correctable, and it's going to take some work, but you can do it.
Yep.
So very good, Bob. I
And
just want to
we're-
say what we're going to talk
You're going
about.
to say be careful out there.
I'm going to say that later. We can fix just about anything except
A
for
broken heart.